Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today we're talking about osteoporosis, a disease that weakens the bones.
So osteoporosis is porous bones or a thinning of the bones. Most commonly occurs with aging. The bones do naturally become thinner with age, and that puts us at risk for having fractures as we get older, the most dangerous of which would be hip fractures and spine fractures.
Who is at risk for osteoporosis?
Age is probably the biggest risk factor. If you've had fractures already, you're more likely to have more fractures in a low bone density. If you are very thin and have lower muscle mass, you're more likely to have a low bone density and fractures.
How important is calcium?
Calcium is one of the main components. It's the mineral component of the bone. And so it is very important that we get enough calcium throughout our lives, starting when we're building our bones from a very young age into our adulthood.
How can vitamin D help?
One of the main functions of vitamin D is to help the body absorb calcium from the intestine. So first of all, you have to have enough calcium coming in for vitamin D to be effective. And then if you don't have enough vitamin D, you won't absorb as much calcium, so the two really work hand in hand.
How important is exercise in preventing osteoporosis?
Just being active and being healthy will help keep the bones strong.
If someone is concerned about osteoporosis, what should they do?
It is recommended that women over 65 and men over 70 do get a bone density test. Certainly if someone is found to have a low bone density, again, speaking with their doctor to make sure they're getting healthy calcium, vitamin D, exercise, and whether or not their risk would warrant any additional help beyond that with the medications that we mentioned.